Hi there, I'm Alex and it's April the 28th, 2024. So it is time for our 4-month proper update of my testosterone androgel gender affirmation journey. So I started this journey, you may recall if you watched the other videos, in December 2023, December 28th, with one pump of 1.62% androgel applied once a day. And then I went to 2 pumps, then 3 pumps, and now I'm up to 4 pumps, and I've been on this for about a month now. And it's 81 milligrams a day, 2 pumps to each shoulder. And I want to continue our update journey on letting you know, like using the World Professional Association for Transgender Health guidelines, what is supposed to be happening and what's actually happening for me. So probably be different for everybody. But the big reason that I'm doing this is gender affirmation journey with hormones after the age of 50. And that's my demographic. So it's there's not a lot of information, particularly using testosterone. I think there's more information for people transitioning with feminizing hormones, and so there's just not. I haven't been able to find a lot. So I'm going through this for chronicling my own journey, but also hopefully to help someone else. So all right, let's jump in then, using that same guideline that we used last time. The first category is skin oiliness and acne, and still nothing there, and I'm knocking on all the woods because I'm not interested. So that's a no. Facial body hair growth, again, this isn't supposed to happen until 6 to 12 months, but I am still noticing some facial hair growth. I will say that I started a routine with microneedling, facial acupuncture, because I have a close relative who is an acupuncturist and who has purchased the micro needling setup. So I'm pretty jazzed to have had that done, mostly because it's really fun. It actually hurts too, by the way. So I'm not going to tell you it doesn't hurt. I didn't do any like lidocaine or anything like that. And wow, it's not without pain. So, but I mean, I already noticed a difference in like age lines and some of the signs of being over 50 from one treatment. So hey, why not? I'm gonna do 6 months of that, and I'll let you know how that goes as we do this. Scalp and hair loss, no thank you. So nothing yet on that. I'm not interested. I will say on the hair journey, it's been very interesting to see. Like, I've always kept my hair quite short, and I have grown it a little bit more now than typically I would, and I don't know what that means. I don't know if that's like I have permission to grow my hair out now because I'm a little more gender ambiguous. I literally have no idea. I'll unpack that later or never, but that's absolutely a thing. Body fat redistribution, 1 to 6 months. I mean, again, I absolutely notice the redistribution of body fat on my lower body, but I'm noticing that while, like I said, I'm a runner, so my thighs are kind of large to start with, and I think that's just my body composition. They're quite muscular. I am noticing that my hips are slimming, and the fat is redistributing. One thing that's just shocking to me is that I've gained weight. Like, I don't eat more. I guess I'm a little more hungry, but I'm definitely not eating more. And I am noticing that I've gained about 7 or 8 pounds, which I understand about 12 pounds is a gain that people who use a cis male dose of testosterone end up gaining 10 to 12 pounds. And not super excited about that. But my clothes fit better, so I don't know. I'm not sure. I'm reporting that you are likely to gain weight on testosterone over 50. So, all right, so that's that. Cessation of menses, again, not applicable because I don't have a uterus. So clitoral enlargement, again, yeah, absolutely yes. And I wrestled with how to talk about this because I want to keep this, I don't know, suitable for work, I guess. I would like to say that the entire genital region is different. And it is not just the clitoral enlargement, or the last time I mentioned, the numbness and the viscosity changes in typical body fluids in that particular region, but everything is different. Like, there's no predictability in the way that one who's achieved the age of 50 or above kind of you sort of know your body by now, and my body is definitely not something I know right now in that respect. So. Okay, so that's that. And then vaginal atrophy, again, still not a thing. Deepening of the voice, I mean, you can hear it. So I have clients and patients ask me regularly if I have a cold now. or if I have something, going on with my throat. And I haven't really shared this journey with many people that I work with professionally. I am a licensed physician and a licensed mental health counselor. So people see me, but no one's really asked me a lot of questions. So I don't think it's that different, really, or else they're just being polite. I'm not sure. So one thing I did want to talk about is my labs. Like, I got blood work done since we last chatted on March the 28th. So my testosterone, which started in December at 14.9, it went to 219 in at the February blood draw, and then at this blood draw it was 464. So this is the first time it was in physiological range for a cis male, which is 300 to 900 nanograms per deciliter. So mine's at 464 about a month ago. So we'll see where it is now. It's probably a little bit higher now. I'd like to have it about 550 and then hang out there. I don't really feel like I need it to be any higher than that. So we'll see what my doctor orders. Okay, so the last thing I want to talk about is emotional changes. Again, I disclosed a few minutes ago that I am a licensed healthcare provider. So I work mostly in psychological wellness now as a licensed provider. On the medical side, I prescribe medications for people who are struggling with mental health issues. And then on the therapy side, I do therapy with folks on all day, every day of the week, except for weekends. So, I'm kind of, this is what I do. This is my thing. I understand it well. And so I've been very interested in watching my own mood and affect and how it's changed or rearranged, I'm going to say, throughout this process. And, I queried family members, people that live with me and people that know me. And it seems like most people say I'm happier, like agree with me that my center is, I'm generally just a happy person, but my center is happier. Like I feel more joyful still. I don't feel that I have, I don't know, even the regular anxiety that folks have in the same way that I even had before this testosterone journey. Excuse me, the areas of improvement feedback that I got was that I am a little quicker tempered than I have been in the past. And, these are people that have known me a really long time. And so I understand that I am, which I agree with. I mean, I'm not unconscious to my own behavior. I am more ready to burn it all down, if something kind of upsets me. But that doesn't happen very often. I think that's happened maybe 3 times since this journey started, maybe 4, which is too many. I said in a previous video, it's not my intention, it's my impact that I care about, because I don't want to hurt anyone or impact anyone negatively. But, the quicker fuse and more significant response has definitely been a thing. And so I'm just kind of watching that. I'm watching that to just make sure that I don't become one of those people who thinks that, oh, well, I can't help it, it's my hormones. That's ridiculous. So I won't let that be me. But I am paying attention to that. Generally speaking, though, I don't think I'm much different than I have been. I'm, again, a really lucky, happy human. So that's that. In terms of sleep, my sleep is so much better. My sleep-wake cycles are leveling out, whereas before the addition of hormones, I think I just didn't have any hormones in my body, so I felt like crap, which is a really interesting thing, whether you're, centered in the gender that you currently reside in, or whether you're, transmasc or transfeminine or just non-binary, whatever the thing is that you are. Like, when you hit that age of 50-ish, where, your hormones are dropping off and you just don't have enough. I mean, it absolutely makes a difference to consider for you. Let your doctor help you. Think about your risk factors, because if your risk factors support, like the risk-benefit ratio supports you getting some hormonal assistance, get that estrogen and progesterone, get that, testosterone replacement. Even if you're a cisgendered individual, I can say with certainty, it has improved my life. So I'm here for it. I guess I would say that to pretty much anyone. In terms of are people noticing me being more male or more masculine? Probably not. I mean, this is how I've been my whole life, so I can't really imagine that it's all that different. Again, I do not need people to gender me in a certain way. I know that's not true for everyone. I don't care what pronouns people use. I don't care how people speak to me or what they say about me or to me, because it's not their journey, it's my journey. And so for me to inflict my journey on someone else feels all wrong. You know, now if people would be outright buttheads, I would probably, I don't know, it might hurt my feelings, but I probably still wouldn't say anything because remember, I'm a therapist. So kind of what we do. So I feel like there's not really much that's going to rattle my cage in that way. I yesterday had the opportunity to interact with some people in a business setting where I was there for quite a long time because purchase I was making, and you know, at first people didn't know what to call me, and then which was kind of weird and funny, but also interesting and fascinating, and I really enjoyed, I enjoyed the experience because I haven't been out a whole lot due to my work schedule and just life schedule, so that was pretty cool to see. But again, I am not hung up on people gendering me in any particular way, so it doesn't matter to me. My name is Alex. I am Alex. I'm Alex. Okay, well, thanks so much for watching. I really appreciate it, and I will see you all again right here for my 5-month update on 5/28. Bye.